Welcome to the Resort Report. I'm your host, Drue Murin, and I've been experiencing a little bit of knee pain lately, so I came to Tahoe Orthopedics and Sports Medicine here in South Lake Tahoe to meet with Dr. Jonathan Finnoff, practicing a rather new but minimally invasive procedure they call ultrasound. Let's go take a look. Welcome back to the Resort Report. I've now sat down on the exam table here with Dr. Finnoff, Director of Sports Medicine here at Barton Health. And Dr. Finnoff, I'll tell you what, it's come to spring and summer. I'm getting out there on the bike, getting out there running. I'm noticing a little bit of swelling. Might have had an injury over the winter or previously. Tell me what we can do.
Well, where's your knee hurting?
Mostly on the inside right here.
Okay, and it's been going on for how long now?
It's been going on for probably about 3 months.
Okay, and is it provoked just with impact activities, or does it also hurt at rest?
Well, mostly impact activities, like when I work out and stuff like that. Mostly running. I notice a little bit of swelling, a little puffiness afterwards.
All right, any clicking, popping, locking?
Not that I've noticed.
Is it more of an aching pain, sharp stabbing, shooting? How would you describe it?
It's more of an ache.
Okay.
You know, an ache, and I get a little bit of pain on here on the inside and whatnot. And I heard you have this new procedure.
Yeah.
That I'm really excited about, and that's why I'm here today.
Oh, great, great. Yeah, the ultrasound machine, and I'll talk to you a little bit about that now. So you're not feeling any instability, you haven't had an acute injury, but maybe a remote injury, you're getting some swelling and pain along the inside of the knee here. If I got it right?
Right, right. And I've had some injuries on this knee before, so that's why I think there could be something there.
Okay. Well, I think first thing, let's do a physical examination, and then we should get an x-ray on that area and see what's going on, okay? Okay.
So tell me a little bit about what we're going to be doing today.
So after we get do the physical examination and the x-ray, if everything looks good and I don't see any significant injury that would require something like an MRI, then that fluid that you have in your knee, we might want to drain that off and send it for analysis and see that, number one, do you have some type of inflammatory arthritis going on? Because this happens somewhat randomly just with activity, and you're young and healthy. So is this something that's underlying a real problem inside of your knee, an infection, inflammatory arthritis, or is it just some wear and tear from your previous injuries? And once we've figured that out, then we can decide if we want to do some type of injection in this area, bracing, strength training, aerobic conditioning, a change and modification in your activity. So a lot of different things we can do.
And that's what kind of attracted me towards your procedure, was it's not really that invasive.
Yes, yeah. And it's also, I think that it limits some of the pain that a lot of people experience when they do get a knee injection, because I can see where the fluid is, I can guide the needle right into it, I can use local anesthetic to numb up the needle track the best possible, and so it really minimizes the discomfort of a procedure that a lot of people don't want to have.
It's true. And other than knees, what other parts of the body can we do?
Boy. Ultrasound can be used for all sorts of different things. You know, in addition to draining fluid from various joints and from cysts, like ganglion cysts in the wrist, it can also be used to diagnose tendon disorders, so rotator cuff problems, tennis elbow, jumper's knee, Achilles tendonitis, hip problems, all over the place. And not only can it be used for diagnosis, but it can be used for specific procedures. And some of those are injections, like cortisone injections and lubricant injections, growth factor injections, but it also can be used to do different, essentially mini surgical procedures. So if somebody has carpal tunnel syndrome, you can use ultrasound, to guide a needle down and actually loosen the ligament that's pushing down on your nerve as it goes into your wrist. You can do that for trigger fingers and for other tendon problems. You can use it for if people have tendon problems in their Achilles tendon or their patellar tendon, you can guide a needle into that area and fenestrate or put holes in that tendon and put growth factors there. And
well, we're going to take a look into this knee here in a second.
Yeah.
And, the cool part is you can be actually back at work the next day.
Absolutely.
So
absolutely.
We'll be back with more of the Resort Report and take a look at this knee right after this. Welcome back to the Resort Report. Dr. Jonathan Finnoff, Director of Sports Medicine here at Barton Health. We're now looking with the ultrasound, and there's no babies in there, is there?
There's no babies, but there's definitely fluid. You actually have fluid inside of your knee, right in this area. And you'll see as I push in that spot, see all that fluid fill up inside of your knee? Yeah, so you actually have a fair amount of fluid. Well, because of your x-ray, which we just looked at, I didn't see any significant arthritis, and the physical examination didn't suggest that you had a torn ligament or a meniscal tear or anything. My guess is that you're just having some early degenerative changes and you're getting overuse. I know, even at your age. But with a history of trauma, it's so common. But I do think that we need to get an analysis of this fluid and see that, number one, because you are young and healthy and your x-rays look good, we want to make sure that you don't have an infection, which definitely can happen. A crystal arthritis, sort of like gout. Or an inflammatory arthritis like rheumatoid arthritis. And if all of those are normal, then it probably is just overuse and some wear and tear in that knee that's not bad enough to show anything on the x-ray. But the good news about that, Drew, is that if everything looks good on the x-ray and you don't have any other underlying disease, we should be able to get you out doing all the stuff you want to do with no problem.
Hey, that's good news.
That's very good news.
So where do we start?
So the first thing we're going to do is we're going to drain all that fluid out of your knee. Okay, so go ahead and lay back there and just relax.
Now I hear this is painless and only takes, what, how long does it usually take for a procedure, Dr. Finnoff?
The actual procedure itself takes a matter of a couple of minutes. It takes a little while to do all the scanning and to get everything set up, but the actual procedure is really quick. Okay.
And you're telling me I could be back to work tomorrow? Back running even tomorrow?
I wouldn't run tomorrow, but definitely back to work. Okay, so just hold still there, Drew. All right. How is that? Is that?
I don't even feel a thing.
Okay. Fantastic. Good.
So what was that?
So that was the local anesthetic. That's lidocaine to numb up your skin and the tissues around that joint. Now we're going to go ahead and drain that joint so it should be nice and numb. Tell me, does that feel sharp at all?
I don't feel it. No, I don't feel anything. A little prick, but nothing big.
Okay, here we go. Here we go. Okay, we're in the joint. We've got the needle inside of the joint, and now we're going to go ahead and drain that fluid out.
How much fluid is in there, Dr. Finnoff?
Well, I'll tell you in just a second. Here we go. All right, it's draining. It's draining. Okay, about 30 cc's of fluid.
Is that good, bad, ugly?
A fair amount of fluid. Normally you can't drain anything out, and so 30 cc's is a fair amount of fluid in that area.
Now, if we don't treat it, would the fluid just come back?
Well, it's variable. So if this is not due to an underlying condition, then by modifying your activities, doing rehabilitation, compressing the area, icing it, and so on, hopefully this will not come back and cause you future problems. And if you have continued problems, persistent recurrent effusions, then we'd really need to proceed with an MRI and look at the integrity of the inside of your joint, and you might need a more aggressive procedure.
And that took only minutes.
Yeah, no problem.
Now, when you talked about lubricants and stuff like that, am I a candidate for something like that?
Absolutely. Yeah, as long as it doesn't show some other underlying condition. But if it doesn't, then a lubricant is definitely an option. And then we'd work a lot on the strength of your hip girdle and thigh musculature so that you absorb more shock in your thighs. We'd start out with a non-impact aerobic conditioning program like cycling or rollerblading or something of that sort, and then gradually increasing in towards more impact activities. We'd work on your running mechanics and make sure that you're running properly and have good form and technique. And we might have you take some nutritional supplements such as glucosamine or chondroitin sulfate. A brace is sometimes very helpful, just a compressive sleeve to prevent fluid from reaccumulating, and icing after activity. And with all those different things, hopefully you'll be back out there doing everything you want to without problems.
Perfect. So we're going to do what next?
So the next thing we're going to do is we're going to send that fluid off for an analysis, and then we're going to get you into a PT program to start working on all of those different things I was just talking about. Okay.
Well, we got PT coming up next. We'll be back with more of the Resort Report right after this. So Dr. Finnoff, where can we find more information on this procedure and all other procedures that you do?
Well, just go online, and we have a website. You can see it on the screen, or you can call us at the number on the screen, and we'd be happy to take care of you.
Well, thank you so much, Dr. Finnoff. And a special thank you to Tahoe Orthopedics and Sports Medicine, acronym TOSM. They're awesome. That does it for the Resort Report. We'll see you next time. Here we go.